Hello, Matt. Great to see you again.
Good to see you again, Miss Pamela. How are you today?
I'm excited to have another amazing conversation. And today, I want to talk about something that I still get in my office with patients asking questions. Patients that come in with missing molars, usually they're 6-year molars because we've had them the longest time, and they have TMD issues. And they're like, I don't want to have that tooth replaced. Is that really important? So I thought we could start there. Give me your thoughts on this topic.
So you have the patient that has the missing teeth, like you said, and they might be just a little bit heavy in their weight. And when you mention something about missing teeth, they pat their belly and say, "Well, you can see I can eat all right." And so they have no desire, to spend money, go to the dentist, and have the dental appointment, may have to have surgery, et cetera, et cetera. And it's very obvious why they would not want to care about their missing teeth. But let's talk about gears in a car. If you had teeth missing off of gears in a car, it wouldn't run right. Now, there are two types of patients that you can categorize two types of patients, one in pain and one not in pain. The one not in pain, it's going to be a hard sell to convince that person because they've been doing so well and they can eat whatever they want to eat. But the person in pain may listen a little bit more. So let's talk about people who are in pain, and that's what this podcast is all about. So, why should they have missing teeth replaced, especially if they're back teeth? If you think about the very last tooth being missing, and you think about that joint, if you bite down and the jaw is able to move upwards because it doesn't have any stability, you're going to what? Compress that joint. As you and I have talked about throughout all the podcast, that compressing the joint is not a good thing. Can a person adapt to it? Of course they can. But if they have problems and pain, then you have to look at every avenue. So, tooth replacement. Tooth replacement can be removable, something that comes in and out of the mouth. It can be a bridge. In order for it to be a bridge, you have to bridge from one tooth to another tooth. So that means if your last teeth are missing, you can't have a bridge. So you're limited to something that comes in and out, which we call partials, and are implants. An implant is basically, in layman's terms, a screw that goes into the jaw and acts like a root. That's what it's called, a root form implant. Now, what most people don't know that there needs to be a crown to go on top of that implant. So it's very expensive, but it is the most lifelike tooth replacement. And it can re-support the jaw and the joint in people who are missing teeth. So are you with me on this? Any kind of comments that you have on this, Pam? Because you have to see this exactly the same thing I did. It's universal.
Yes, I just want to expand or elaborate a little bit. If we go back to, okay, if it's the very last molar in people's jaw, if you're to our listeners and watchers, if it's the very last molar, which is the second molar, not wisdom teeth, and you're missing that tooth, I want you all to understand that second molar is paramount to support the TM joint. Think of it as the column that holds your mandible in like a solid place so your joint can't get pushed up and back and get compressed. So when we lose that second molar, you can eat and you can function and feel fine, but over time, you're going to get more arthritic and dysfunctional. And at some point, you can start to spiral into pain and dysfunction and jaw locking, etc. Because Mac, you and I both know most patients that seek our care are people that are in pain or they want to look attractive, Otherwise, a lot of people are not going to replace teeth because, like you said, I eat just fine. Um,
Yeah, you can't see them.
you can't see them unless it's a front tooth, and still, even some people. they say they're fine. So when you are missing a back molar, and you've come to see me, it's usually for cosmetics and for function, get you out of pain. It is paramount there is that we replace the molars so that you can have a balanced bite. It's not possible to have a physiologic balanced bite unless both sides, supporting sides, are there and are balanced. It's like leaning on one leg all the time and walking on heavily on one side. I mean, you can't imagine your hips and your back are
Right.
gonna be okay with that, right?
Common sense. And if you have a lot of missing back teeth, it's like walking on your toes.
Mhm.
You can't you can't walk on your toes and walk a marathon. It's you're putting too much stress on the structures.
On the
And
front
if you're
teeth,
mi
you
yeah,
need
and if you're
to
missing
keep your
front teeth,
toes. Yep.
well, what's the value of a tooth for not hurting? Again, we have to build value to our patients so that they can see why they need to spend that money. Now, to have that foundation that you're talking about, you got to be a very well trained dentist because if you put that crown in, if you put that bridge in, you put that partial in, denture in, implant in, and it's hitting off 30 microns from what it should be, it's not going to be comfortable.
Right.
So the burden is tremendous on the dentist when they go to replace missing teeth. So you got to choose your dentist wisely. But the mechanics of the mouth are very important because if you think about it, they're like a second backbone. You have the teeth that hit together that stabilize. If you're going to have a wreck, if you're about to hit something, you're going to clench your teeth because you want support. It's not any different with the backbone, and you're going to brace yourself with support. So people in pain, they need to have a full complement of teeth, and the teeth must fit together very precisely. So
Mhm.
we dentists have a tremendous responsibility to the public. And the more educated the public is, and the purpose of these podcasts is that they can go to their dentist and be armed with information that is valuable.
So for our listeners, if you're going to be our TMJ sufferers, right, Mac? If you come in for treatment to start getting your quality of life back, we don't have to replace teeth right off the bat. It really is case dependent with whatever you may be coming in with. We can create orthotics built in a neuromuscular bite so that we can start to provide you with some type of balance that you can function in. And because TMD sufferers, TMJ sufferers, usually this is a chronic condition, meaning it's been something that's built over time. Acute is if you suffered an accident and a blow, and then, those are actually the easiest ones to get comfortable really quickly and very simply. But chronic sufferers, when we do phase one treatment with oral appliances, we don't always have to start with rebuilding and replacing teeth. But most people don't want to live with an appliance in their mouth forever. They can, and some of my patients and your patients did, but most people want to just, have teeth in their mouth that they can function with and look good doing it, eat whatever you want and look good doing it. And that's the part where, once we get patients really comfortable, then, you need to have that conversation, listeners, with your dentist. How do I go about replacing the teeth that are missing in the back? And if there's some in the front, so that you can have an even playing field to work with, so that you can function with balance. And, Mac, you said this best, and I use this all the time still in my office. I want our listeners to understand like teeth are like books on a bookshelf. The minute
Right.
you pull one book out, the other ones start to lean. And you don't think that's a big deal. But imagine if you have like a small, like a shed or a home, and then there's all these big oak trees around it. And then they start rooting underneath the foundation of your home, and the roots start to push up on it. And now it really starts to affect the foundation because the foundation of your home is no longer level. You've got these weird structures at different angles. The level is gone. Well, that house is going to start to crumble. A patient, because of these shifts and tilts, will have more imbalances more dysfunction, which can trigger them in that whole cycle of pain. And it's so gradual. Sometimes they don't even understand that it's building, this negative feedback and chronic pain has been elevating until something triggers them out of control. So that's usually a phase two conversation. But, people that are listening, I want you to understand, or Mac and I's point is, you can't lie to yourself and say, I've got missing teeth, but get me out of pain and keep me stable for a long time. You've got to give your dentist or us like a level playing ground so that we can create good function for you.
I had an interesting case. It was an older gentleman, older than me, that was diagnosed with TN, trigeminal neuralgia, by his MD, but referred to me by a dentist. He had missing upper teeth and missing lower teeth. But his joint was just on fire because he had a deficient maxilla. And when he closed down, he retruded, et cetera, everything we've talked about in other podcasts. So I love what you're saying about the orthotic being acting as if it is replacing the missing teeth. So you build a lower orthotic that can replace missing teeth in the back or in between or in the front, doesn't matter where it is. But my challenge was, what was I going to do on the top with the missing teeth on the top?
Mhm.
And so what we did is make him a partial. Now we need to explain what a partial is. You have full dentures, which means people don't have any teeth at all. And you have partial dentures, which means that they're partially missing teeth, and that one device replaces all the missing teeth. So I used this partial to replace all the missing teeth on the top, and I used this removable orthotic on the bottom, and it worked like a charm. It got him out of pain immediately. Now, to take it a little bit further, if that patient were younger and wanted to spend money, then you could go through the implant process and have the crowns put on at that jaw to jaw position, because the jaw to jaw position is absolutely critical in helping you TMD patients.
Mhm.
And the other thing is that the value of a mouth, if you take an implant and a crown, probably in your area, would that be about $5,000?
An implant from,
Implant and crown?
no, it's going to be usually $8,000 to $9,000 per tooth.
Okay, so let's just make $10,000 to even it off, and you've got 28 teeth to replace.
Mhm.
What's the value of a mouth?
To some, it should be priceless. To me, it is.
It's priceless, but it's in the hundreds of thousands of dollars.
Mhm.
So we got to get our heads on straight is how important it is. You take a tooth out, you've removed a part of your human body just like you removed a finger.
Right.
You know,
Sometimes people live in areas or they come from times where there wasn't a lot of preventative dentistry. It was like, okay, you have this tooth that's in trouble. Let's just pull it out. Let's just pull it out. And that's all they were exposed to and all that was known. That's one side of things. But then there's also the other side of things where, I know we open up and say things that maybe are not always easy to hear, but sometimes it's just flat out neglect from the person. They didn't want to go to the dentist or they ignored advice that could have saved a tooth. And so, while I know dentistry is expensive, $50 is expensive to some people, much
yeah,
less $50,000. It's all relative to that person. But, to me, when people come in with a multitude of like tooth decay, gum disease, TMD. Okay, it's never a finger pointing thing ever. But I mean, I tell them, it's overwhelming. I get it. There's ways to budget and finance for it. However, you have to think all that money that you never spent all these years is
true.
essentially now and then some because now it's worse and it's a bigger problem. But let that go and let's start working on it now. So it's not even more because what? You're going to let it go till you need joint replacement that is $250,000 and half the time effective and then needs to be redone in about 5 years. It never gets cheaper or easier. Give yourself grace and forgive yourself, but expense is part of what you have to anticipate. So if we can also go back to one thing, um, because not everybody picks up from episode one of our podcast, you know, if we think of the face, the head, and separate it in three components, there's the upper face, which goes from the top of the head to the bridge of the nose. The middle face, which is your maxilla, goes from the bridge of the nose to the edges of your front teeth. And then there's your lower face, the lower third, which is your mandible, which is your lower jaw. And that's a free floating bone. The mandible, the way it sits on up until the base of the skull, that's your TM joint. And what stops this mandible in space, because it's like a swing, right? It's held to the skull with muscles and ligaments. So it's like a porch swing. What stops it in space is when you put your teeth together. So put your teeth together, everyone. Okay, you just stopped your mandible in space. So if you're missing back molars, okay, well, now your mandible is going to be kinked up on one side and not the other. Or let's say the other molar in front of it tipped and now it's kinked up in a weird way. So as you start to chew and swallow and talk, these muscles that move your jaw in space are constantly being strained in weird patterns, which then ultimately ends up causing pain that manifests in different ways, be it headaches, ear issues, eye issues, fingers, all of the things that we've talked about in the past. So if you're looking for TMD treatment, in phase one, we don't necessarily always have to replace molars unless you have no uppers, like Mac just illustrated with one of his cases. But at some point, if you're in this for the long game and you're not in your late 80s and 90s, doing tooth replacement really needs to be part of your next step of your TMD treatment once you're out of pain and feeling better.
And that only makes 100% common sense. The problem is, I don't want to go to the dentist. The problem is, I don't want to spend the money. And those are real objections. But to live a normal, healthy life, it only makes sense. And what's the value of feeling good and being healthy? What is the value? Especially at my age, it's everything.
Mhm.
In your age, you want to live to be what, 100 and what?
105. 105. That's my number,
105,
man.
105.
105. And I want to do whatever I want till I'm 93. But even at 105, I want to be able to eat whatever I want and look pretty good doing it still.
So let me ask you a very personal question. In the unlikely event that you would have to go to a nursing home at that age, which table would you rather sit at? This is pretty risky. The table with the knives and forks or the one with the blender? That's crass, but it's real. It
It's-
paints a picture that you need to understand how important teeth are. They're invaluable.
Mhm.
Just think about it.
That's so true. And I love hearing that perspective because, I'm in my middle ages. You're just a little bit ahead of me. And
A little bit.
some things that I'm not thinking that way about, but I'm sure my patients would. And we shoot straight all the time. And think that's why those certain patients come to us. Well, I'm not for everybody, that's for sure. But that's such a great perspective. Thank you
It's
for,
an open up conversation.
as always, right? That's what we do.
Right. Well, I mean, in all reality, since the invention of the blender, you don't need teeth.
That's true. But like I said, my goal for the people that come to see me is that as long as you're on this great earth, you can be able to eat whatever you want without pain and just look good doing it.
And smile when you walk into a room to light up that room. That is, I know your goal and my goal, so I'm sure everybody else should feel, you know, you want to have beautiful teeth. That's just natural.
So, not an easy answer, but it's honest and real. I hope this is helpful to our listeners. Thank you, Mac.
Thank you, Pam. Later.
Until another time. Bye.